So we were studying about the category of drugs that are used for treatment of hypertension. Now next class is there, that is direct renin inhibitors. So direct renin inhibitors are directly blocking the activity of the renin, so that further synthesis of angiotensin 1, 2 and aldosterone will not be there, and due to that there will be reduction in vasoconstriction, sodium water retention and the mechanisms produced by them, so which is resulting in reduction of the blood pressure and hypertensive state of the patient. So example of the category of drug is that is aliskiren. So this category of drug, they are showing their potency that is comparable to the other category of drugs like ACE inhibitors, ARBs and CCBs, and they can be utilized for treatment of hypertension as monotherapy, that means single line therapy, or we can use them in combination with other drugs also. So we can administer them with thiazide then ACE inhibitors, ARBs or CCBs in combination. These category of drugs are producing fetal abnormalities, and that's why they are contraindicated in pregnancy. Now some adverse effects associated with the direct renin inhibitor. That is, first is orthostatic hypotension, erectile dysfunction, diarrhea and weight gain. Now next example is that is reserpine. So it is a vesicular uptake inhibitor. That means whenever the synthesis of neurotransmitter is occurring, so they are being stored in this vesicle. So vesicular uptake is helping for the release of neurotransmitter also. That is the one of the step which is associated with the release of neurotransmitter. So whenever there is a precursor that is formulating the catecholamine, this form catecholamine, it is stored in the vesicle, and after means the contraction mechanism which is exerted by the calcium, it is resulting in release of that neurotransmitter by the exocytosis process into this synaptic cleft, and this release neurotransmitter will bind to the various receptors. Those are situated on the postganglionic nerve fiber, and afterwards they are producing their mechanism. So this vesicular uptake, if we are preventing it directly, then the synthesized agent will not be stored in the vesicle, and it will not be released in the synaptic cleft, and thereby it will not be available for the activity that is oriented at the receptor site, and due to that the response, that is excessive or sympathetic response, that is being generated, that gets minimized, and that will be helpful for minimizing hypertensive effects. So it is reducing the sympathetic tone and reducing the blood pressure. So some points associated with the reserpine are, that is, it is having long half-life. So as long half-life is there, that means it will not get eliminated in a shorter duration of time, so it will be lasting in body for longer duration, and due to that it is prescribed as a once a daily dosing parameter. So again it is causing, that means if we are utilizing it for minimizing the hypertensive complication, then it will show its effect within 2 to 6 weeks. Again it can show its significant effect which is associated with the sodium fluid retention, and that can be the beneficiary outcome associated with the reserpine. That means it is reducing sympathetic tone, as well as again it is reducing sodium water retention also, and it can be utilized along with diuretics also, which can give more beneficial effects. The adverse effect associated with the reserpine are nasal, means they are minimizing sympathetic tone, that means they are activating parasympathetic tone, and due to that they will produce parasympathetic effects like means nasal stuffiness is there, the rise in secretions, that is increased gastric secretion. They will means affect motility also and produce diarrhea and can cause bradycardic state. But if suppose we are utilizing the higher doses, then they can reduce the means neurotransmitter level to more severe extent, and it can lead to cause mental depression also, and that's why we have to is insert the minimum doses of reserpine in the patient. Now next category is there, that is direct acting vasodilator agents. So vasodilatory agents are showing their mechanism, different mechanism by different activities. That is, first is related to nitric oxide. So nitric oxide, it is causing the activation of guanylyl cyclase, which is utilized for conversion of means GDP to cyclic GMP, and it causes the relaxation. And that's why if nitric oxide is there, release of nitric oxide is there, then it produces relaxation. And the example of drugs are nitroprusside, hydralazine, nitrate, histamine, and acetylcholine. So they are directly producing vasodilatory effect, which can minimize hypertensive complications. The next mechanism is there, that is reduction in calcium influx. So calcium influx, if it is reducing, so there will be relaxation. That means contraction gets inhibited. Again, the examples are mentioned here. The next mechanism is associated with the potassium channel. That means influx of potassium, if it is there, then it will cause hyperpolarization state, and due to that the smooth muscle means vascular smooth muscle relaxation is there, and due to that hypertensive effect is also get minimized. Again, the examples are minoxidil and diazoxide. Then again, activation of dopamine receptor. So these are the some basic mechanisms which are causing direct vasodilatory effect and minimizing hypertensive state associated with the patient. Now here are some adverse effects associated with the vasodilators are, that is lupus-like syndrome. Lupus-like syndrome means that is this means symptoms like wolf bite. Means whenever wolf bites and whatever symptoms that are producing afterwards, so such symptoms are producing, and that is considered as lupus-like syndrome. Then dermatitis, drug fever, peripheral neuropathy, hepatitis, muscular headache, then hypertrichosis. That means excessive hair growth is there, that is on face, arms, back, and chest. So these were the old category of drugs that were utilized for management or treatment of hypertensive state.